So let's take a look at our sepsis screening. Here you will see level 1 and level 2. For a patient to meet serious criteria or screen positive on the sepsis screening, they must meet at least one requirement in level 1 and at least two requirements in level 2. For example, a patient complaining of shortness of breath with tachypnea and a heart rate greater than 90 will screen positive on the sepsis screening. You will see an alert that states patient meets criteria for sepsis risk. Initiate MEC approved protocol sepsis order set. Alert responsible MD immediately. Close here, scroll down. It will have you fill out level 3. You may or may not have some of these answers at this time. Even if you click none, the patient has already screened positive due to level 1 and level 2. So I will scroll down to my response. Sepsis screening. This patient is a sepsis risk. I must alert the responsible LIP, and then it's a select all that apply. Depending on what that LIP orders give me is what I will click next. It'll either be a code sepsis or no action required, and write the name of the physician or LIP here. It's important to know that some patients may screen positive multiple times, even though the physician, due to clinical judgment, is deviating from the sepsis. For example, a patient with a CHF exacerbation might have shortness of breath, tachypnea, and tachycardia. The LIP has already been made aware of this, that the patient is screening positive due to those three conditions, and I could document LIP previously notified. However, keep in mind, if that same patient meets criteria due to a different requirement, for example, this time it's because the WC came back and we're greater at 12, then I must alert the MD again. There has been a change. It's not the same reason. So I will alert the MD and go from there. I may call a code sepsis, or MD wants to cancel code sepsis, deviate from code sepsis due to clinical judgment, document no action required, and the name of the physician. For every code sepsis, we will utilize the code sepsis checklist tool. At the top here, you will put the patient's label, the time the code sepsis was called, and in this case, I'm giving the example of 12 o'clock, and the name of the physician. We will then initiate the 3-hour bundle. Everything that you see here on this checklist that must be filled out must happen within 3 hours of calling the code sepsis. Number 1, lactic acid collection time. I give an example of collecting the lactic acid at 12.10. If the result is greater than 2, I must have a repeat lactic acid within the 3 hours of the code sepsis. So, because the first lactic acid was drawn at 12:10, I must have it before 15:10. Here you will see the example that the repeat lactic acid was drawn at 14:30, which puts us good in the window. Second step here, we have blood cultures. Blood cultures must be drawn 15 minutes apart. They were drawn approximately around the same time as the first lactic acid. So you see 12:15 and 12:30. It's very important that the IV antibiotic start time is scanned and documented after the last blood culture set. There have been cases where phlebotomy or techs will draw the blood cultures, write the time after, and you have already scanned the IV antibiotic. In real time, the blood cultures were drawn first. However, what does it show in documentation? That the time was after your scanning time. So make sure that if your last blood culture time was 12:30, that your IV antibiotic start time is after that. Here we have 12:40, so we are good. Also, you will administer fluid resuscitation, at least 30 mLs per kilogram of the patient weight over 1 hour, unless specified for the physician. The physician may document an exclusion criteria, for instance, a patient with CHF or Risk of fluid overload, they may want to give the patient less than the recommended 30 mLs per kilo. If not, we are going to give 30 mLs per kilo. You have your fluid start time and your fluid stop time. It's very important that you do stop the fluids in the MAR, because after your fluids have been administered, you need to document 2 blood pressures within 1 hour after the completion of IV fluids. For example, here you will see if your fluid stop time is at 10, then you must document 2 blood pressures between 10 and 11. For this example, we see that our IV fluid stop time was at 1400. So I must document 2 blood pressures between 1400 and 1500. Here you will see that 2 blood pressures were documented at 1415 and 1430, which puts us good in the 3 hour window. If at this point the patient continues to be hypotensive even after the fluid resuscitation, meaning the systolic blood pressure is less than 90 or the MAP is less than 65, we must alert the physician and determine need for vasopressors.